Fewer people insured, but less deficit spending. That's the latest analysis of Obamacare by the Congressional Budget Office. Chief National Correspondent Jim Engel runs the numbers for us.
The Supreme Court case changed only one thing in the health care bill: how many people the states were required to put on Medicaid health care for the poor. And the Congressional Budget Office said today the number of uninsured will go up by 3 million, but the government will save money over 10 years.
So while they put out a number that showed $84 billion in savings, that's not a big number, $8 billion a year in a very large trillion-dollar program, and there's a lot of uncertainty around it, and they say so.
The CBO did not predict how many states will expand their Medicaid populations, the primary way the administration planned to reduce the uninsured.
CBO does not say how many states. It does not say which states.
The report simply said, quote, fewer people will be covered by the Medicaid program, more people will obtain health insurance through the newly established exchanges, and more people will be uninsured. Those who go out on the exchanges get generous federal taxpayer subsidies, while the states would have to pay out of their own pockets to expand Medicaid, something they may try to avoid.
All of those people can go over into a new health insurance exchange, and the federal government will pay almost all of their premium, and that will be private insurance.
Republicans have argued for repealing and replacing the health care law. Today, the CBO said that would actually add $109 billion to the deficit over a decade, leading Democrats to issue a challenge.
So those who favor repeal have the burden of coming forward and arguing how they would reduce the deficit.
CBO, of course, only computes what Congress says it will do, and the law says it will raise revenue in part by cutting Medicare by $500 billion. The chief actuary of Medicare says that would eventually reduce payments for Medicare recipients to less than those on Medicaid.
That means the senior citizen will be less attractive to doctors from a financial point of view than welfare mothers. How long do you think that can go on before seniors start complaining to their members of Congress?
And a new study today by Deloitte said about 10% of big employers plan to drop health coverage as the law takes hold, in part because they don't trust administration predictions.
Congress has a long history of underestimating the costs of things, and so one would expect that healthcare costs will continue to rise in the future, despite best efforts.
Companies have wrestled with the uncertainty of the new law, and many can't be sure how it'll work until they see it in action. In the meantime, they're keeping their options open. Brett?
All right, Jim, thank you.